Hi, I'm Dr. Sian Cole, and this is part 2 of understanding persistent pain through neuroscience. Unfortunately, I was unable to get the video all up in one go, so here is part 2. So really just to kind of go back through a little bit about what was discussed in part 1 is that we don't actually have any pain inputs. It's not really how our brain works. We've got our 7 senses. So everyone is pretty much aware of the first 5, but we've also got the sense of proprioception, so a sense of where our body position is. So even if we had our eyes closed, the lights off, we would know if we had our arms up and down or what position our body is in. And then the other sense is equilibrioception, which is about sensing our body movement. So it's kind of like when you're on a roller coaster, if you're being accelerated or if you're upside down, things like that. So you can really think about that being a bit of your middle ear input. So these 7 senses gather information from the environment and they go into our brain. And then our big brain, with all of its hundreds of thousands of neurons, analyzes the information from the senses and actually merges it in with relevant past information, knowledge, and memories. So you can think back to the checkerboard illusion. You weren't consciously thinking, oh, I've seen a checkerboard before. But your brain was doing that itself, and it was looking at the squares and the patterns and analysing it all. And that's how it was actually giving you the illusion of the different colours. So in the context of persistent pain, or actually any pain, when your brain receives some information, particularly information about tissue damage or even the possible threat of tissue damage, your brain, or even just remembering actually, old memories of tissue damage, it will determine if there's a threat or not, if touching that fire is going to be a threat or not. Now, this is a completely automatic reaction that our brain does, just like the vision in the illusion. So our brain determines if there's a threat or not, so it kind of weighs that up. And then your brain will produce pain. And this is actually both for acute pain and persistent pain. So we can actually learn to reduce the threat by understanding what the threat is. And this is a role where psychologists can come in and actually help people with some of these techniques that might help reduce that extra emotional struggle we put in, learning things such as mindfulness, pacing, and even understanding our emotions can be really helpful. So we've got the input coming in, our brain analyzes it, and then it produces an output of pain. And this is the same with our thoughts and our feelings as well. So in summary, no brain, no pain. So it's good that we do have a brain, and it actually is good that we do have pain. It's a very useful protector that we have. So in summary, pain is an automatic output that our brain will produce if it thinks that it is about to be threatened. And that could be threatened with being bitten by a dog or about to hurt yourself, but also doing an exam. You can get a headache thinking about it, or doing things that you've been putting off. Our brain will give us the response of pain if it feels that we are being threatened. Another interesting fact is that when we're doing scans of people's brains, emotional pain and physical pain have the same pattern as well. So reducing emotional distress can actually really help with the severity of the pain that our brain produces for us. And just again to reiterate, there is no pain nerves or fibres. Just like there is for hunger and thirst. It's actually our brain weighing up a number of factors out of our conscious control. So the thing about hunger is really interesting. There's definitely times we can eat and not feel hungry. We can smell certain smells and feel hungry, and that doesn't necessarily mean that we need more sustenance. So it's really interesting, I think, learning about the brain. So all pain is normal. This is kind of what I've already said before. It is a really important function and it's excellent and helps us not to hurt ourselves terribly. So we do need to, understand that all pain is normal and that one way that we can manage it is to kind of reduce the threat. Sounds simple, but it also sounds complicated at the same time. So what we want to do is just try to understand what your brain sees as threat and actually kind of help reduce that. And that's, again, where psychologists can come because everybody is individual in that process. So hopefully these are some ideas that might help reduce the threat your brain perceives. So one thing is understanding that our brain is constantly looking for input. It is a greedy sponge and it wants information and stimulation. So if we're engaging in meaningful activities, that can actually really help our brain reduce some of the threat. And it's really important because in pain, you tend to do less and less, and then your brain actually gets upset about that, and then that's the threat. And that can be one of the cycles that chronic pain can get us stuck in. Another really interesting thing is to think about using the word pain and maybe changing that up. You can think about as soon as you say pain, your brain's bringing up all of those memories of being in pain before. It's the same as anything that's familiar to us. If we think of the word lemon, we can actually think about the lemon tree in the backyard or lemonade or even maybe taste it, the sourness if we really get caught up in that word. It's kind of like tagging, like you do on Facebook with pictures, like a neuro tag. So sometimes just saying, oh, there's my discomfort, or there's my tightness, or there's my ankle being sore again, that can be really helpful. Another thing that we know is really kind of reducing those emotionally laden words. People who are going to be describing their pain as terrible, killing me, can't cope, are going to report high levels of pain. So if we're able to kind of maybe break that down into the sensations, acknowledging the pain because your brain wants that. It wants to know, yeah, I can feel that my knee is tight and hot and stabbing. That is going to help you make room for that experience as opposed to when we're using a lot of those emotional words. Another thing that we've found really useful is engaging in activities mindfully. So that's doing one task at a time, observing what we're doing rather than being judgmental. So I've got some videos on mindfulness if you want to learn a little bit more about that. And I'm not talking about meditation or trying to not think. It's actually the opposite to that. It's about being mindful, focused, engaging on one task at a time. Some other things that I use a lot, so this is what I do when I help patients, especially those who are current inpatients. So you've got a lot of pain, but the thing is we know that motion is your lotion. So physical activity is what's going to get you better. You take the painkillers so you can go and do your physiotherapy. The painkillers don't actually help you get better and stronger, but they do help you engage in activities so that you then can get stronger. So motion is your lotion. Another thing is I'm sore, but I'm safe. Again, it's what your brain wants. It wants to acknowledge that you understand that that's setting off the pain alarm, but that it's not necessarily indicative that there's more danger or harm being done. So reminding yourself you are safe. And this is really important for that delayed onset muscle soreness we can get after exercising. Some people think that it might be hurting them more, but it's actually the muscles getting stronger. So it's not necessarily a bad pain, and not all pain is. So some of our patients who've had like a hip replacement or a knee replacement, they might be thinking that the gym is actually making them worse. Yes, they do have pain, but it's actually strengthening the muscles again after the surgery. So again, motion is their lotion and they're sore but safe. So knowing your pain, can actually help you make your gains. So that's another thing that we definitely do too. And that's what this whole video series is all about. And I've got a little comment about that you are not your thoughts. I'm not going to have time to go into that too much, but it's just about acknowledging that sometimes you can have a thought and really believe it to be true and not even question it. And sometimes these thoughts are really unhelpful. So we can kind of just let them go. We don't have to give them our full attention. You know, talk to your health professionals, find out what is important, what you need to understand about your pain and how you can get better, really. So I've got a video on pacing. It's a really good way to understand about how to actually use activity to reduce your brain sensitive to pain and get better, as opposed to when we do the boom bust, which actually can make it worse. So I'll also add some other videos that are excellent that I will put in the description of this video. Thank you.